On today's episode of the podcast, it's a special Mother's Day edition, and I have a very special guest. It's actually my own mom. She's going to be sharing a really uncommon cause of heartburn and a unique solution that we found. So listen in, and if you enjoy this episode of the podcast or find it helpful, subscribe to the podcast so you get notified of our future episodes.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. Today is a special Mother's Day edition, and for that, I have a very special guest, someone that I've known for a really long time. It's actually my mom. So welcome.
Well, thank you, David, and what a happy Mother's Day treat to spend this time with you.
So you were having some heartburn issues that started a while ago, and we found some unusual things that you really wouldn't expect to control heartburn. But can you tell a little bit about when this started and what you were going through when it first all started?
Right. Oh, my goodness. It was probably back in January of 2019. I was having a lot of upper abdominal discomfort, and I went to my primary care doctor. And he said, "Oh, yes, you've got acid reflux or GERD, as the doctors were saying." And so we went on some over-the-counter medications, just the Mylanta and Tums, that kind of thing. And it persisted. So I went back again and then got a referral to a gastroenterologist, and they did an upper GI, and they said, "You've got gallstones." And I'm like, "Really? That's a surprise." So I ended up in June of 2019 and having my gallbladder out, and had a normal post-op course, and seemed fine. Was on a low-fat diet as prescribed for gallbladder removal, and in a couple months, I started noticing a similar discomfort. It was not the pain I was having, on the initial primary doctor and GI visit. It was kind of a burning sensation in this upper abdomen, like under my ribs and my lower rib cage. So I went back, and they then put me on some prescription medications, like omeprazole, and I guess that was the main one I was on to reduce the stomach acid, thinking I've had gastritis. So they sent me for another upper GI, and they did biopsies. Everything was normal, no cancer, no ulcers seen. But it was probably gastritis, they say. So another year goes by, and it's now 2020, and everybody's kind of reluctant to go to the doctor unless it's an absolute emergency. But then finally in the spring, I went back and still discussed the GI issues of the GERD and gastritis. I ended up this year in 2021, January, going back for another annual upper GI. And same thing, negative biopsies and diagnosis of gastritis. I talked to you on the phone, and I guess you listened to my frustration about it. It's not food related. It's I just didn't understand it. And, you persisted with some questions about, my activity, describe the pain, the location. And you said,
And just to jump in here before you kind of tell about what we came to it,
okay.
Up to this point, my mom's in Florida and I'm in St. Louis. And up to this point, it sounded like everything made sense medically. Rule out cancer. It's a GI problem. Go get the GI system checked. There's some gallbladder stones. Yeah, have the gallbladder surgery. And, everything really made sense until the gallbladder was taken out. And then the symptoms were really still persisting. And then, as you described it a little more, which we can go into, it sounded like, oh, well, that might not actually be something to do with digestion. So go ahead and continue.
Oh, okay. Well, it wasn't food related. I could eat anything and nothing made it better or worse. It was intermittent discomfort, and it wasn't pain. It was burning or a throbbing in my ribs. Sometimes I would feel it from around the back and rubbing my ribs, bending, stretching. That seemed to relieve some of the discomfort. Used a heat pack, and still was kind of frustrated with the mystery pain, the mystery burning.
And at this point, if heat's relieving it and positional changes are relieving it, and it doesn't seem food related, at that point, it started to seem like, well, maybe this is a musculoskeletal problem. And, really that burning kind of in the rib cage or, upper abdomen is actually a pretty common symptom of a thoracic disc or a thoracic nerve problem. That the thoracic discs and thoracic nerves tend to refer pain around actually to the front of the body at roughly the same height where the nerve is irritated. So we started to go down that track.
And I was like, really? So I got some advice from David to do some yoga stretching, deep breathing exercises. And within a week, I started feeling relief. I didn't get the burning sensation as often. And so I continued to work on daily exercises. Basically the child's pose from yoga or the knee chest position seemed to help, and also sleeping with a pillow between my legs aligned my spine. So all of these things seem to really be the answer. I went in for a follow-up with my GI doctor, and I told her what conclusion we were coming to. And I said, do I still have to take all these medicines? At this point, I was on 2 or 3 different medications. And she said, well, finish up the sucralate, which is kind of created a coating in the stomach. Finish that up and then keep trying the exercises or doing the exercises. She said, no, let's stop everything. And that was in March. And it's now June, and May, and I am feeling really pretty good.
So, and just a couple of things to put some context around that too. My mom's someone who always has had very good upright posture and tried to stand up straight. And really, the thoracic spine, it's supposed to have some forward bend. It's supposed to have some slouch. And one of the really common things that happens with people who have thoracic problems is they try to stand up straight and stand up tall like they've been told their whole life by everyone. Don't slouch. Your mom probably told you that back in the day. And people can go the other way with it. You can be too upright and too extended. And really a lot of the stretches and exercises that she was describing were things that put more forward bend in the spine, like the child's pose and like bringing the knees to chest or sleeping with a pillow on between your knees and your knees curled up in like a fetal position. or even just doing some deep breathing where you expand the rib cage and stretch out the muscles in the abdomen. So it's really interesting to see how something that you might not typically think is musculoskeletal can be musculoskeletal. Now, just a little disclaimer here: if you do have heartburn and it's something you're not used to, make sure you do check all the things that would normally cause heartburn. Don't sure, go ahead and do the stretches. They're not going to hurt anything, but get the GI stuff checked. Rule out that you're not having a heart attack. Rule out all the stuff that could be really serious problems. And if the stretches seem to help and all that stuff comes out checked negative, maybe that's the problem. But it just goes to show that things aren't always what they appear on first examination. So thanks a lot, Mom, for taking the time to share your story with people, and hope you have a happy Mother's Day.
I do. And hopefully some people who are listening to your podcast will also have that, maybe I should think about this myself.
Well, if even one person gets some help from this, then it was worthwhile taking the time to share it. And if not, it's always just good to talk to you anyway.
Oh, you too. Thanks a lot.
All right.
Have a great weekend.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice at 314-941-3970. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.